Imagine this. You're walking through a crowded park on a sunny afternoon, enjoying the sights and sounds of the day. Suddenly, a commotion breaks out nearby. A man walking his dog calls out in alarm as someone collapses to the ground just a few feet ahead of you. People gasp and gather around, unsure of what to do. Would you know how to respond in such a situation? Every second counts when someone collapses, and your actions in those first few minutes can make a life or death difference. It's a daunting thought, but knowing what steps to take can empower you to act decisively and potentially save a life. Let's break down those crucial actions together. Before rushing in, it's vital to ensure your own safety and that of others around you. Take a moment to pause and evaluate your surroundings. This brief pause can make a significant difference in how effectively you can help. Quickly scan the area for any immediate dangers, such as oncoming traffic or falling debris. Look for anything that could pose a risk to you or the person in need. This could include unstable structures, electrical hazards, or even aggressive animals. Once you've determined it's safe to approach, you need to assess the situation. Approach the person cautiously, keeping an eye out for any changes in the environment that might affect your safety. Gently shake the person's shoulder and ask loudly, "Are you okay? Can you hear me?" This initial contact is crucial to determine their level of consciousness and responsiveness. If there's no response and they remain motionless, it's crucial to check for breathing. An unresponsive person who is not breathing needs immediate medical attention. Look for the rise and fall of their chest. This visual cue can help you quickly determine if they are breathing. Listen closely for the sound of breaths. Sometimes, breathing can be shallow or irregular, so take a moment to listen carefully. Feel for any breath against your cheek if you're comfortable doing so. This can be especially useful in noisy environments where it might be hard to hear breathing. This initial assessment helps determine the severity of the situation and guides your next steps. Whether it's calling emergency services, starting CPR, or simply staying with the person until help arrives, your actions can make a critical difference. If the person is unresponsive and not breathing or only gasping, it's time to act quickly. Immediately, call for help. This is a critical moment where every second counts. The faster you act, the better the chances of survival for the individual. If you're alone, use your phone to dial 911 or your local emergency number, and then begin CPR. Make sure to put the phone on speaker mode so you can use both hands for CPR. The emergency operator can guide you through the process if needed. If others are present, ask someone to call 911 while you start CPR. It's important to communicate clearly and assertively to ensure that help is on the way. Assign specific tasks to bystanders, such as finding an AED, automated external defibrillator, if one is available. CPR, or cardiopulmonary resuscitation, helps circulate blood and oxygen to the brain and other vital organs. This manual pumping action is crucial in keeping the person alive until professional help arrives. Remember, the goal is to maintain blood flow to the brain and heart. Place one hand on top of the other in the center of the person's chest. Ensure your shoulders are directly over your hands to use your body weight for effective compressions. Proper hand placement and body positioning are key to delivering effective CPR. Push down hard and fast, aiming for a rate of 100 to 120 compressions per minute. The depth of each compression should be about 2 inches. Allow the chest to fully recoil between compressions to maximize blood flow. A helpful tip is to compress to the beat of the song "Stayin' Alive" by the Bee Gees. This song has a rhythm of about 100 beats per minute, which is ideal for CPR. Keeping this beat in mind can help maintain the correct compression rate. Continue CPR until emergency medical services arrive. Do not stop unless the person starts to breathe normally or you are physically unable to continue. Your persistence can make the difference between life and death. Stay focused and keep going until professional help takes over. Section 4. Advanced Life Support, AED, and Continued Care. In this section, we will delve into the critical role of AEDs in emergency situations, and the steps you need to follow to ensure the best possible outcome for the patient. An AED, or automated external defibrillator, is a portable device that can deliver an electric shock to the heart to restore a normal rhythm. These devices are designed to be user-friendly, with clear instructions and voice prompts to guide even untrained individuals through the process. AEDs are often found in public places like shopping malls, airports, and community centers. Their strategic placement ensures that they are readily accessible during emergencies, significantly increasing the chances of survival for someone experiencing sudden cardiac arrest. If an AED is available, have someone retrieve it while you continue CPR. It's crucial to maintain chest compressions to keep blood flowing to the brain and other vital organs until the AED is ready to be used. Once the AED arrives, turn it on and follow the voice prompts. The device will provide step-by-step instructions, making it easier for you to administer the necessary care even under pressure. The AED will analyze the person's heart rhythm and advise whether a shock is necessary. This analysis is crucial, as it determines the appropriate course of action based on the specific condition of the heart. If so, make sure everyone is clear of the person, then press the shock button. It's important to ensure that no one is touching the patient to avoid accidental injury from the electric shock. Continue CPR after each shock, or as directed by the AED, until medical professionals take over. Consistent and effective CPR combined with the timely use of an AED can make a significant difference in the patient's chances of recovery. Remember, every second counts in these critical moments. Section 5. Why these steps are crucial. Each step we've discussed is vital in increasing the chances of survival for someone who has collapsed. Assessing the scene ensures your safety and allows you to provide help effectively. Checking for responsiveness and breathing helps determine the severity of the situation. Calling 911 or your local emergency number immediately brings trained medical professionals to the scene as quickly as possible. CPR helps maintain blood flow and oxygen to the brain and other vital organs until medical help arrives. And using an AED, if available, can potentially restart the heart if it has stopped beating effectively. Section 6. You can make a difference. Witnessing someone collapse can be a frightening experience, but remembering these simple steps can empower you to act swiftly and confidently. By taking charge of the situation and providing immediate assistance, you can make a real difference in the outcome. Consider taking a CPR and AED training course. These courses provide hands-on practice and can boost your confidence in handling such emergencies. The skills and knowledge you gain could one day help you save a life. Section 7. A final word from HandyMind. When someone collapses, stay calm and assess the situation. Call for emergency services immediately and ensure the area is safe. If trained, begin CPR and provide first aid as needed. Your calm and prompt actions can make a significant difference. Be prepared, be courageous, and be the help that's needed in those critical moments.